So today we will be focusing on those. One is cholera and another one is E. coli infection. So these two, amoebiasis, endemoeba histolytica and Giardia lamblia. These are the two diseases which we have studied in our previous class. And today we will focus on these three. One is cholera, and second one is the E. coli infection, and third is the dysentery. So cholera is a very dangerous disease because if you look at cholera, nowadays cholera is less common. Still, sometimes during rainy season, you may be able to see newspaper reports that cholera is affecting people. So, in case of cholera, this is the bacteria that is causing cholera. Here you can find a brief idea of what are the main symptoms of cholera. See, these are some of the main problems. There is very clear fluid, vomiting of clear fluid, almost like watery diarrhea will be there, very high level of diarrhea, lowering of blood pressure will be there, then breathing will be of a special type, there will be muscle crampness will be there, cyanosis, the lips will be appearing quite dark blue, the eyes will be sunken or in a depression. So these are some of the major features like watery diarrhea. Sometimes it is known as a rice water diarrhea because the loose motion will be in the form of rice water. That is why it is also rice water diarrhea. So a lot of water and lot of fluids, lot of minerals will be gone from your body. So what happens is that too much loss of water will be leading to dehydration. Now, very little water in your body. Our body is mainly 60 to 70% water. If too much water is lost from your body, that will be affecting the way our cells, tissues, and organs are working. So that will finally lead to death. So that is what is happening. See here, you can see that very faster rate of pulse. Then vomiting is the hypovolemic shock. The pressure becomes very low, and that will be leading to a shock. And at which point death can occur in 12 to 18 hours. So even though cholera is a bacterial disease which can be controlled if properly treated, if the patient is not cared or treated properly using antibiotics and other medication, it can lead to death. So that is a problem with the cholera. And here the cholera is caused by the bacteria known by the name Vibrio cholera. Vibrio cholera is the name of the bacteria. This is the bacteria that is causing cholera. Here you can see that. So cholera is a very dangerous disease nowadays because of the presence of antibiotic. It is somewhat controlled. But even when this kind of disease usually comes into picture when there is some kind of environmental like flooding or earthquake or landslide. So during such situation, people may not be getting proper water, proper food, and safe water, safe drinking water. All these will be leading to what you call water pollution, water contamination, and then whenever you might have, for example, earthquake. If there is an earthquake, there is always a possibility of cholera outbreak. So such a kind of environmental calamities or natural calamities will be always triggering these sort of diseases like cholera. And cholera can be very easily treated. Here you can see some pictures regarding cholera. See what kind of problems are creating by the cholera endemic. So these are some of the problems where cholera can lead to very intense situations. See, so this is how the cholera can be transmitted. So that is about the first disease, and the main method by which we can prevent cholera is drinking potable water or boiled water. So when there is a during rainy season, these kind of outbreaks can increase. So drinking boiled water is the best method. Then second one is E. coli infection. In case of E. coli infection, it is caused by one type of bacteria known as Escherichia coli or Escherichia coli. Both way it is pronounced. So water contaminated with this bacteria. Normally Escherichia coli is not a very dangerous disease, but it can lead to diarrhea and cause death in immunocompromised. Immunocompromised means you might have heard about AIDS. In case of AIDS patient, what happens is that AIDS virus is actually attacking our immune cell. So when AIDS virus is attacking immune cells, what happens is that immune cells may not be able to protect our body from infection. So our immunity will be lost. So such people who have the immunity lost are known by the name immunocompromised individual, and also very young children, then also elderly. So normally adult people will be more healthy, but very young children and very old people, both are very vulnerable. They are there. So that is why any kind of, even a small diarrheal infection caused by E. coli can be dangerous in such people. So elderly due to dehydration and as from prolonged illness. So even though diarrhea, if it is for one day, it is okay. But if it is continuing for so many days, it is going to kill you. So that's the problem with E. coli infection. Now another type of dysentery is known as a dysentery caused by Shigella. Here you can see that Shigella is also a very, Shigella will be causing shigellosis. Here maybe some pictures may be aware. This is the bacteria that is causing the Shigella. Here you can see the very rod-shaped bacteria, and it is also caused by contaminated water, frequent passage of feces with the blood. So that is your intestine abdominal wall will be affected, and there will be blood in your fecal matter, and mucus. In some case, vomiting of blood can also take place. So these are the problems in the case of Shigella and Salmonella. So Shigella, here you can see this is the Shigella. Sometimes it is known by the name Shigellosis. Here some pictures are available. We'll show you. See, an intestinal disease caused by a family of bacteria known as Shigella. Symptoms are diarrhea, abdominal pain, cramping means contraction of muscle. It is known as a cramping. Fever will be there. Then here you can see what are the complications: dehydration, rectum may be coming out, that is known as a rectal prolapse, seizure, the person may be unconscious, getting unconscious, hemolytic uremic syndrome, there is one then toxic megacolon. So these are all complications caused by Shigella, Shigellosis or Shigella infection. So that is also a disease caused by waterborne bacteria known by the name Shigella bacteria, and same is the case with the Salmonella. Here also you can find how the cholera is being transmitted, what is the type of bacteria, and here also some pictures are there. Here this is another picture showing how Escherichia coli, all strains of Escherichia coli are not harmful. Here you can see that only one or two strains of Escherichia coli can lead to this kind of incubation period is 1 week. See the bacteria here, this is in bacteria die when food is exposed to heat. So even a mild heating, even if you are not boiling water, if you are warming the water up to 70 degree, within 70 degree or 80 degree, majority of the bacteria will die. Some bacteria may still survive and they will be killed only if you are boiling water for 5 minutes. That is why government and doctors always say keep the water boiling for a few minutes. Don't switch off the turn off the gas immediately once the water starts boiling. Keep it boiling for 1 or 2 minutes, 3 minutes, so then most of the bacteria will be dead. So here you can see what are the symptoms. See here also, even though it is Escherichia coli, there is still a death rate of 3 to 5%. So Escherichia coli can also be dangerous if not treated properly. Then we see another disease known as leptospirosis. You might have heard about leptospirosis because in Malayalam we call it as Ilipani. So leptospirosis is a very dangerous disease, and also here you can find leptospirosis. So here also you can find leptospirosis, very small picture. So in case of leptospirosis, most of the time it is caused by rodent, known as ratus, or other kinds of wild animals, caged animals. Here you can, I am showing some better picture of that. Here also it's very small picture. So in the case of leptospirosis, so here you can put the I am not able to see a good picture of that. So here you can see all this is how the leptospirosis is not normally transmitted. It can pass from human beings to a rat. From rat, when the rats are laying their putting their feces in water body, and animals like cow, dog, etc. They will be taking that, and from the body of and when they are defecating in water, and if you are drinking that water, that will be again come to our body. So these are the steps through which leptospirosis is caused by a bacteria known as Leptospira. Now, water contaminated by animal urine carrying the bacteria. So that is how the bacteria can be transmitted. Begins with the flu-like symptom, then slowly resolves. But second phase then occurs involving meningitis, liver damage, and kidney failure. So that is the problem with the leptospirosis. In case of leptospirosis, sometimes it can lead to a very dangerous situation, and that dangerous situation is usually caused by high fever. The picture is very small. So in case of this, there will be meningitis. Meningitis means the brain has an outer membrane known as meninges, and that membrane is sometimes having an inflammation or swelling. That inflammation or swelling of the brain membrane, outer brain membrane, is known as a meningitis. Then liver damage can happen, and that will be visible as a jaundice or yellowing of our eye, skin, etc. Then kidney failure can also. So that is why leptospirosis can be a very dangerous disease, because it can lead to kidney damage, and it can also lead to liver damage. So this is the problem. Then another kind of disease is known as a typhoid fever. In case of typhoid fever, typhoid is nowadays very less common. Earlier it used to be a major problem, especially during rainy season. So typhoid is also a waterborne disease. Here you can see that so typhoid normally the here you can find maybe this picture we will take. So in case of typhoid, what is happening is that there will be bacteremia. These are some other ulceration, intestinal bleeding. So these are some complications of typhoid. So and there will be that is enteric fever. Enteric fever means enteron means your intestine. Anything that is affecting your intestine or enteron is known as will be leading to a type of fever known as enteric fever. And typhoid is a one type of enteric fever. That is, your stomach and intestines are primarily affected. So and it can also affect your spleen, and it can affect your gallbladder. So there will be a lot of complication in the case of typhoid fever. So here what is the case is that there is sustained fever, that is 104. You know what will be the situation even our temperature increased to 101 or 102. So what is the case when temperature is increased into very high level of 104, above 40 degrees centigrade? So it is too much fever, and that can lead to profuse sweating, and there will be diarrhea. Then symptoms progress to delirium. Delirium means the patient may be showing mental abnormality. That is known as a delirium. The brain cells will be affected. So that will lead to some kind of madness in those individuals. Then spleen and liver enlargement will be there if it is not treated properly. So that is the main complication in this of typhoid fever. In this case, it can last 4 weeks and cause death. So nowadays, typhoid can be treated. It is a bacterial disease, so there is antibiotics are available. but earlier typhoid was a major problem. There was no antibiotic, and typhoid can cause death in many people. So now this is treatable, but what is important is that proper care at the right time should be given. Some people with the typhoid fever develop a rash called rose spots and small red spots on the abdomen and chest. Now I will show you some symptoms of typhoid. So in case of typhoid fever, these are the, see here also you can find that. Earlier they are showing that rose spots are there. See here you can see that. These kind of rashes on the abdomen, rose spots on your body. All these are indication that it is a typhoid. So this is how typhoid can be a dangerous disease. It can lead to death. So even, and the type of bacteria that is causing the typhoid is known as a Salmonella typhi. Now we come to another kind of disease known by the name hepatitis A. Sometimes you might have heard about hepatitis. Hepatitis A is caused by hepatitis A virus. So in case of hepatitis A virus, so here you can see that how hepatitis A, this is how the hepatitis A is പറയാൻ നേരമായോ പോയിട്ട് ആഹാ അതൊന്നും ഉണ്ടാതെ ഇരിക്കണായിരുന്നു ഇത് ലൂസാണ് ഇടക്കിടക്ക് പോകും ഇപ്പൊ കേട്ടിട്ടും പ്രത്യേകിച്ച് കാര്യമൊന്നുമില്ല എന്നുള്ള പറഞ്ഞിട്ട് എനിക്ക് പറഞ്ഞു സാറ് പറഞ്ഞോട്ടെ സാറിന് എത്ര വരെ 5 മിനിറ്റായോ പോയിട്ട് ഓക്കെ. So this is hepatitis. So in case of hepatitis, this is a highly contagious viral fever, and this nowadays it can be prevented by taking vaccine. So there are two types of microorganisms. One is bacteria. If it is a bacterial disease, you can treat it with the antibiotics. But if it is a viral disease, you cannot treat it with the antibiotics. Presently, there is no drug against the virus. There are some very highly expensive drugs are available known as interferon, but still they are very expensive. So as of now, there are no drugs against virus. That is why when you have a viral fever and you go to doctor, doctors won't give you antibiotics because antibiotics may not help if it is caused by a virus. So in case of hepatitis, it is caused by a virus. Now what our present strategy is that we take vaccine. What vaccines are doing is that they will be injecting into your body very weak doses of this bacteria, this virus, so that our body will be producing antibodies against that. So when next time the same virus is entering your body, these antibiotics will fight off the infection. So that is the approach or in treating all viral disease. And in this hepatitis also, it is a viral disease, and if you take once we have this hepatitis virus in your body, next time you may not be able to get the hepatitis. So if you either you have to get infected or you have to take the vaccine. So vaccination is the best method for treating hepatitis. Now here you can see it is spreading by direct contact, infected food and sewage contamination. And these are the problem. There is jaundice will be there, nausea will be there, abdominal pain will be there. So these are some of the complications of hepatitis A. So here you can see that most of the time it is entering your body by contaminated water. See here you can see what are the symptoms. Fatigue will be there. Fatigue means very high level of tiredness, extreme tiredness will be there. Abdominal pain will be there, nausea, diarrhea, weight loss will be there. So these are some complications of hepatitis. Here also you can see that how hepatitis can affect you. See here there will be jaundice, there will be vomiting, and there will be fever, low appetite, dark urine, diarrhea, weakness and joint pain. These are some major symptoms of hepatitis. Even though hepatitis A is not such a very dangerous disease like hepatitis B, still it can create difficult situation. Then another major disease is the poliomyelitis. You might have heard about poliomyelitis. because polio nowadays, polio is fully cured, eliminated from India. See, this is known as a poliomyelitis. So in case of poliomyelitis, see, so this here you can find one child being affected by polio. See, this kind of problem, earlier it used to be a major problem. So what happens in the case of polio is that it will be causing weakness of your bones, and there will be bending of bones, and that was the case of polio. That is why polio has been, but polio is a viral disease, and this viral disease can be very easily treated if you take polio vaccine. You might have this polio drops, why nurses and doctors will be giving polio droplets to the children. So it is a vaccine, very easily it can be cured. Now from India, polio has been completely eradicated. But there are few countries where polio still exists. But in most of the countries of the world, polio has been completely eradicated. So polio is also a waterborne disease. Here you can see they enter water through feces of infected individuals, especially animals. 90 to 95% of the patients show no symptom. So that is important. Only in 5% of the people, 4 to 8% of the people will be having minor symptom. There will be delirium, that is brain may be affected, and there is headache, fever, and occasional seizure. Seizure in Malayalam we call abasmaram type disease. Then spastic paralysis. That person may be unconscious for some time. So these are some problems, but 1% have symptoms of non-paralytic aseptic meningitis. Brain can be affected, so neurons can be affected, and the rest have serious symptoms resulting in paralysis or death. So this is how the polio can be a dangerous disease. Here you can see that how the polio, 90% have no symptom, 10% have flu-like symptom, 5% have paralysis. So here virus replicates or reproduces inside the intestine. See here you can say virus can go into the bloodstream and extend to the spinal cord. When it is entering into the spinal cord, your neurons are affected, and that is leading to this kind of situation known as bending of your neurons are affected. So that it is causing this kind of bending of the legs. So that is how the nerve cell damage can occur, can cause muscle paralysis in legs, muscles of the abdomen, thorax, brainstem, and sometimes also death. So now polio has been completely eradicated from India, but earlier it used to be a major problem. The only solution, there is no proper treatment, only solution is vaccination. Taking vaccination so that your body will be having antibodies against it. So now when a virus is entering your body, it will be protecting you. So the next class we will be going to another area, there are bioindicators. So today we will be limiting to this one. So there are different type of waterborne disease. Polio is one, hepatitis, typhoid fever, leptospirosis, then cholera, E. coli infection, dysentery, then amoebiasis and protozoa. So sometimes you can expect a 5-mark question. Give a detailed account of different microorganisms transmitted through water.